My name is Dr. Suneeta Kochhar. I work as a GP in East Sussex and I'm the clinical lead for cardiovascular disease prevention. Welcome to this video on understanding blood pressure. I will cover what is raised blood pressure or hypertension, why it is important and how to measure blood pressure. It is intended that this video is used alongside practical support from your GP surgery or community pharmacy. Blood pressure is the pressure of blood in your arteries. Your arteries are the tubes that carry blood from your heart to the rest of your body. Your blood pressure naturally goes up and down throughout the day and night. Blood pressure is measured using two numbers. The systolic blood pressure is the higher of the two numbers. It's the pressure against your arteries when your heart is contracting and pumping blood around your body. The diastolic blood pressure is the lower of the two numbers. It shows how much pressure is in your arteries when your heart relaxes between beats. Having persistent raised blood pressure is called hypertension. This means that your heart is working harder than it should to pump blood around your body. Having raised blood pressure is associated with an increased risk of heart disease, strokes, and chronic kidney disease. Up to a third of people in the UK may be unaware that they have raised blood pressure. This is because most people do not have any symptoms. This means that the only way to detect this is by having a blood pressure check. Having a blood pressure check is important to detect raised blood pressure, and if it is raised, it allows for the better treatment of raised blood pressure or hypertension. Treatment of raised blood pressure may include lifestyle factors such as diet and exercise, as well as the use of medication. We don't always know why people have high blood pressure, but some things make it more likely. For example, getting older, having someone in your family with high blood pressure, smoking, drinking too much alcohol, eating too much salt in your diet and not having enough fruit and vegetables, not getting enough exercise, and being overweight. People who are of Black African or Black Caribbean descent are at increased risk of developing raised blood pressure. For some people, a cause of high blood pressure may be found, for example, related to kidney disease. The only way to know whether you have high blood pressure is to have it measured. You can get your blood pressure checked at GP surgeries, some pharmacies, and in the workplace. If you're a healthy adult, aged 40 to 74, and live in England or Wales, you'll be invited to a free NHS health check every 5 years. This will include a blood pressure check. Your blood pressure is usually measured using a blood pressure monitor. This is usually an electronic monitor connected to an inflatable cuff, which is wrapped around your upper arm. Your blood pressure will usually need to be measured more than once to confirm a diagnosis of high blood pressure. This is because blood pressure can go up and down during the day. When people have their blood pressure checked in the clinic, it can be higher than expected, especially if they feel nervous or anxious. If your blood pressure is high in the clinic, you may be advised to take additional readings at home using a 24-hour monitor that checks your blood pressure throughout the day. This is called ambulatory blood pressure monitoring, or ABPM. You may be advised to record additional readings at home using your own blood pressure monitor. This is called home blood pressure monitoring, or HBPM. If you've been asked to monitor your blood pressure at home, your GP will ask you to check your blood pressure over several days. This can include taking a series of recordings, at least two, twice a day, in the morning and evening. By looking at your blood pressure readings over a few days, your GP will work out the average blood pressure and consider how variable the readings are. In some cases, your GP might want to run some other tests as well. For example, they may wish to do some blood tests to check your kidney function and to check your cholesterol, or check your heart rhythm with a test called an electrocardiogram, or ECG. Why measure your blood pressure at home? Your doctor may want to measure your blood pressure regularly. This is to make sure that medicines or lifestyle changes are helping to bring your blood pressure down. You may also want to measure your blood pressure yourself at home. It can be helpful to take blood pressure readings at home, as they are likely to be lower at home than in a clinical setting where you may feel anxious or nervous. Is it suitable for everyone? Many people find it helpful to measure their own blood pressure as they feel more in control of their condition. However, it may not be suitable for everyone. For example, people who have an irregular pulse, which may be caused by a condition called atrial fibrillation. This is because having an irregular pulse may give inaccurate blood pressure readings, and some home blood pressure machines are available to overcome this problem. How to choose a monitor. If you've decided that checking your blood pressure at home is suitable for you, it is recommended that an automatic monitor is used. It is advised that you use a monitor that measures your blood pressure at the upper arm rather than a wrist monitor, which is less accurate. A list of clinically validated home blood pressure monitors can be obtained from the British and Irish Hypertension Society or by contacting the Blood Pressure UK helpline. It is important to make sure you have the correct cuff size. An upper arm monitor will have a cuff to wrap around the upper arm. It should be the correct size to avoid inaccurate readings. It is recommended to measure around your upper arm at the midpoint between your shoulder and elbow and choose the cuff size from this table. Most monitors will come with a medium-sized cuff. Choose a monitor to suit your budget. They can cost from £20 or may be loaned from your GP surgery. Extra features may be helpful, such as a memory function, but this isn't necessary as keeping a blood pressure diary may be more useful instead. The monitor should be calibrated every couple of years to check it is giving accurate results. This can be done by sending it back to the manufacturer, or you may choose to buy a replacement monitor. It can also be a good idea to bring your monitor to your clinic appointment so your GP or practice nurse can check that you are able to check your blood pressure confidently and the monitor is recording accurately. Make sure you're feeling relaxed and rest for a few minutes. Do not measure your blood pressure within 30 minutes of drinking caffeine or smoking, or immediately after exercise or after drinking alcohol. Make sure you feel comfortable and do not need to use the toilet. Sit down in a quiet place, preferably at a table with your arm resting palm up on a firm surface. Your legs should be uncrossed and your feet flat on the floor. Wear loose-fitting clothing so you can easily push up your sleeve. Use the same arm to take your readings, as each arm may give a slightly different reading. Make sure your arm is supported and the upper arm cuff is at the same level as your heart. When you're taking your blood pressure, do not talk, as this can affect your reading. Take 2 or 3 readings about a couple of minutes apart. Some people find the first reading is higher than the rest, so this may be discarded. Keep a blood pressure diary and don't check your blood pressure too frequently, as this can make you anxious and affect your blood pressure readings. Your doctor will advise you how often and when to take your blood pressure. When you start, measure your blood pressure morning and evening every day for a week. Your doctor may advise you to discard the first day's readings, as they may be less accurate when you start checking your own blood pressure as you get familiar with the monitor. Your doctor will advise you on how often to take readings, as they may request you do this less frequently. How not to measure your blood pressure. Media websites often display images, but many of these do not follow guidance. There was an interesting analysis over 1,000 photos of blood pressure measurements across major stock photo websites, and only 1 in 7 images aligned with guidance. In photo A, the back is not supported and the cuff has been put on clothing. The forearm is not resting on the table and the feet are not flat on the floor. The patient and the practitioner are likely to be talking. For photo B, the cuff is placed on the clothing and the forearm is not resting on the table. In photo C, the back is not supported, the forearm is not supported, and the cuff is not in the correct position. Photo D shows a home blood pressure being done by a practitioner, and again the cuff is on the clothing and the forearm is not resting on a table, and they're likely to be speaking and interacting in this photo. Normal blood pressure is usually considered to be between 90/60 millimeters of mercury and less than 140/90 millimeters of mercury for a clinic reading. For over 80s, because it's normal for arteries to get stiffer as we get older, the ideal blood pressure is under 150/90. For your home blood pressure readings, we apply a correction factor and subtract 5 from the top and bottom numbers, so these targets are slightly lower. These are the blood pressure treatment targets if you have hypertension and/or cardiovascular disease. Your GP may recommend a lower target if you have had a stroke or have chronic kidney disease. If your blood pressure is 90/60 or lower, and if you feel faint or unwell, it is recommended that you contact your GP surgery. If your blood pressure is high, your GP may recommend further blood pressure readings. If it is very high, you should contact your GP surgery urgently. Lots of things you can do to help lower your blood pressure, such as cutting down the amount of salt in your food, eating more fruit and vegetables, trying to be more active, reducing the amount of alcohol you drink each week. You can get support from your local pharmacy or GP to reduce and eventually stop smoking. Your GP can help you create a plan to reduce your blood pressure. By making lifestyle changes, you can lower your blood pressure. Your GP may also offer you medicine to lower your blood pressure if it's high or very high. Thank you for watching this video on understanding your blood pressure.